If you haven't seen the video that I just shot about longevity, I think this video goes hand in hand with it. And I want to talk to you about sun damage. The reason I thought of this video, I recently had a consultation with a woman who said that, who is in her late 40s. She says, you know, I feel very young to need a facelift. I said, well, part of it is your very fair skin. You've also got light colored eyes, light colored hair, and I see you've had a lot of sun damage in the past. And even if you've been a good girl and not really been in the sun in the last 5 to 10 years, the cumulative damage that occurred from either tanning beds or progressive sun exposure over your 20s and 30s, unfortunately leads to a lifetime of problems. And so she said, well, my grandmother really has the same genetics I do, and she never got in the sun, and she looked very old and wrinkly when she was older. I said, well, I doubt that's the case, because I will tell you, did you know what she did in her 20s, 30s, or 40s? She says, no, I didn't. I don't. So I said, well, here's the trick. I will tell you, of course, people get wrinkled as they get older, regardless of their sun. But if she's significantly wrinkled, she most likely had significant sun earlier in her life that's catching up with her. Even if you knew her for the last 30 years of her life and she didn't get much sun, that sun is the worst thing for you. Now, you look at me, I've got a slight tan, I've got some hollowness, I've got some, you can see volume loss around my eyes without my glasses. I've got some wrinkles. I'm in my mid-50s. I'm 54 years old, turning 55 in a few months. So clearly there is some aging, but I don't have as much aging because I'm an Asian, so I have a little bit more melanin and skin resistance toward aging. But I look at my cousins who are in their 60s, those that love to play tennis and golf outdoors, especially without much sun protection, they have significant aging on their face. Whereas some of my cousins in their mid-60s look like they're about 35 years old, and a good 35, and they don't even do Botox, they don't do fillers, they don't do facelifts, and the reason is that they don't get much sun. So, and they've never got much sun. So those that don't get much sun really do well. So I liken it to sort of like when the dentist tells you, look, don't eat candy because candy is going to cause dental teeth issues. I don't care if you eat candy, because if your teeth go away, I'm not treating your teeth issues, I'm treating your facial aging. Of course, if you have no teeth, my facial work doesn't look so good, but that's another point. But my point of this is, as much as you can minimize sun, as best you can, that would be, for example, wearing a large brim hat. I jokingly call it an Asian hat. The big hats that look ridiculous, maybe to Westerners. If you think about how Asians hate the sun and why they look younger, it's not just the fact they have a genetic predisposition toward protection, which they do. There's no doubt that's a huge component why I look a little bit younger than my age. But also the other component is they hate sun. What's very interesting is tans in America is looked upon as something very sexy, very cute, very youthful, even though it causes a lot of aging unless you're doing like spray tans. But in Asia, this is what's interesting, freckles are considered very unattractive. If you have 1 or 2 freckles, it's considered terrible. They want to look white. In fact, in Japan, and in China, and Hong Kong, they sell different types of makeup products of various degrees of whiteness. So it is the opposite here. We want color, we want shade. If our legs look too pale and white, we look sickly, we don't look healthy. Asians don't like that. So if you go to Asia and you look at an Asian running down the street, they are not only not usually coming in the middle of the day to do it, but they have a mask covered to here, and it's not even dealing with a pandemic. They have sunglasses wrapped here. They have a hat covering down. They have a big hat that goes all the way out. They wear long sleeve shirts. They have gloves on. Their whole legs are covered. They have almost zero sun exposure, and they're most likely not running in the middle of the day. So that is the reason for that, is that they don't want freckles, and they don't want aging, and they don't want any of those things. And it's interesting, they did a study in Asia, and they said, what looks normal for a 40-some-year-old female? They found that even 1 to 2 crow's feet was considered socially, culturally unacceptable, whereas in America, 2 to 3 crow's feet in your 40s is considered normal, and you don't necessarily need to have 0 crow's feet. So it's just a different standard. It has a lot to do with the cultural, cultural dynamics. So sun is a deadly force in terms of aging, even if you haven't had sun for 10 years. And I encourage you to consider minimizing that sun exposure to help with longevity and improvement. But we don't live Life is short, and I'm not saying never to get sun. I'm never saying don't go to the beach. I'm not saying live as a hermit. But what I'm saying is also make wise choices. Besides doing Botox to help minimize sun damage, good skincare products like Over One, which is what I've made, or facelifts and things like that to manage the ravages and effects of sun damage. But what we can do is make wise choices. Just like, hey, if I'm a dentist and I say never eat ice cream again, well, come on, that's not realistic. I love ice cream. I'm going to want to eat ice cream after a date night, or if I'm out, whatever, I'm going to eat some ice cream. But if I eat ice cream every single day, 3 times a day, not so healthy for me. I may have dental issues even if I'm brushing my teeth and flossing every time. So understand, it's all in judgment and moderation of enjoying things. So for example, let's say you love running. Well, can you run earlier in the morning when the sun is not as direct rays? Can you wear a large brim hat? Can you wear a large sunblock SPF 100? Can you help minimize that? Can you wear long sleeve shirts? Can you wear gloves? Maybe that's too crazy for you. That sounds insane. Can you wear can you wear long pants? Can you do anything to mitigate it? Can you take your run and make it shorter? Can you do part of the run maybe in the evening when there's not as much sun? A tennis player, if you love tennis, you say, well, Dr. Lamb, that's part of my healthy regimen. I love to play tennis outdoors and I love to do it. Well, can you play tennis most of the times indoors? Can you only play it occasionally? When you play it, can you play it with long sleeves? Can you play it with a big hat? Can you play it later in the day? Can you play it, alternated? It's one of those things that is not necessarily an all or none proposition. If you love to go to the beach, can you not bake in the sun? Can you have a big parasol? Can you wear a big hat? Can you use SPF? Can you limit your time on the beach? There's so many things that we can just make wiser choices. If you think of it not as an all or none proposition, you may be able to do more effective ways to mitigate the effects and ravages of sun on aging.